Next speaker is Dr. Choudry, and she, is doing a talk to us, a 6-minute test, a walk test in apparently healthy children.
Good morning, everyone. My study is the 6-minute walk test in apparently healthy children in an observational study. These are my guides. So the assessment of functional capacity is an important component of management and monitoring of cardiopulmonary diseases in children. And various tests are available, the time test being most convenient and simple ones to perform in clinical setting. So the 6-minute walk distance is affected by various factors, and ethnicity is being one of them. And there are very few studies in the Indian population, and they are limited to older children. So we aim to study the normal reference values for Indian children who are aged 4 to 14 years old. Our primary objective was to provide normative data on the distance covered by apparently healthy children in the 6-minute walk test. And we also aim to assess the differential influence of age, gender, height, and weight on the 6-minute walk distance. And we also assess the changes in the vital parameters at the end of the 6-minute walk test. This test was an observational study which was performed in school children from the schools of Bhubaneswar who were aged 4 to 14 years, and a sample size of 400 was included. So we included all the children who were aged 4 to 14 years and excluded children who were having any chronic underlying diseases or any acute illness in the past 3 months, or had clinically assessed anemia and were unable to follow instructions. So the children were allowed to sit peacefully for 5 minutes, and no pre-tests were performed, and the baseline vital parameters were collected, and the children were allowed to walk on a 15-minute walk course for 6 minutes while providing only standardized phrases of encouragement. The sample size was calculated for all the objectives, and the maximum sample size required was based on the drop in saturation, and a sample size of 400 was calculated. So statistical analysis was performed using SPSS version 2022, and ANOVA test and regression analysis was performed, and a p-value of less than 0.05 was considered statistically significant. So we had screened 426 children, and 26 children were excluded, and 400 were able to complete the test. So our study population included 52% girls and 48% boys, and this is the age-wise distribution of our study population. Coming to the results, the mean 6-minute walk distance the children were able to achieve was 365 meters, and the median was 363 meters. And these are the percentile curves showing the distribution of 6-minute walk distance in relation to age in boys and girls. So we observed that the mean 6-minute walk distance increased with age, with no significant difference between boys and girls among all these age groups. And linear regression analysis was performed and it showed that the 6-minute walk distance correlated positively with age, height, weight, and BMI of the children. And these are the changes in the vital parameters that were noted at the end of the 6-minute walk test in boys and among girls. So comparing it with the previous studies, all the previous studies were performed on 30 to 60 meter walk course, and data for 4 to 14 years is available from UK in a study performed by Lamas et al. And they observed that the 6-minute walk distance of 383 was achieved in 4-year-old children, and it increased up to 512 in 11-year-old. And 2 studies from India are available in older children aged 7 to 12 years. And our study included 4 to 14 years age group. 4 years age group were able to cover 307 meters, and 14-year-old age group was able to cover 432 meters in 6 minutes, and our study was conducted on a 15-meter course. So our study is the first study to assess the 6-minute walk distance among Indian children who were aged 4 to 14 years, and the tests were conducted on a 15-meter course in the corridors, which may be more feasible in resource-limited settings like India, where the space constraints become an important issue. And the limitations of the study include we performed a single 6-minute walk test, and we may be able to achieve higher values if on repeat testing due to the learning effect. This study provides normal values for 6-minute walk test in children aged 4 to 14 years, and it was conducted on a 15-meter course. And we noticed that the 6-minute walk distance is significantly affected by age, height, weight, and BMI. So appropriate age-based cutoff should be used while using a single-time measurement of 6-minute walk distance for the assessment of these children. Thank you.
Thank you. That's really great, actually. Really impressive number of patients and some really good results, I think. When you're performing a 6-minute walk test, what is the... It looked like you managed to get most of the children to do it. You only had 26 drop out. What is the primary problem that they have?
The main problem was among the younger age groups, sir. Like 4 to 5 years age group, we were having a problem because the children started to run or over the course. But ideally, it should be only fast-paced walking.
And you were saying that you used standardized commands that were allowed to be used in the test. Is that correct?
The phrases of encouragement were standardized, sir. Like all the children were provided phrases of encouragement at 1-minute intervals, which was standardized for the...
Okay, fantastic, thanks. That's great.
Can I ask observational point?
Yes,
The 2 other Indian studies
yes, sir.
had at least 200 meters more.
Yes, sir.
And can you postulate why your children were a little bit slow, or was there any difference in methodology of those papers?
Yes, sir. The other 2 Indian studies were performed on walk courses of 30 to 60 meters, sir, and we have used a 15-meter walk course. And we are postulating that whenever the child is having to take a turn on the walk course, he will definitely slow down and then take some time to regain the pace. So that is why we are thinking we got lower values, sir.
Thank you.
Yes, sir.
Any other questions?
Actually, this 6-minute walk test is performed in adults with COPD patients. And what is the purpose of this study regarding childhood asthma or respiratory distress? The standard of comparison, the purpose of this study.
So, yes, sir. The 6-minute walk test is not, is commonly used in adult patients currently, but it can be applied to pediatric patients with any chronic cardiac and pulmonary diseases. Like currently we are using it for follow-up of cases with the chronic pulmonary diseases in our center. And we also have children with pulmonary hypertension and mixed connective tissue disorders in whom we are using it for monitoring the disease progression and the response to treatment. But,
Thank you.
Yes, sir.
Thank you.